Hello, everyone. Thank you for joining us today. Welcome to the Avexia webinar series. Our topic for today is Decoding Food Sensitivities, Signs, Symptoms, and Solutions, Food Sensitivity Profile. My name is Christopher Chu. I'm the Director of Marketing for Avexia Diagnostics and will be your host for this webinar. Today, I have the distinct pleasure of being joined by an exciting guest, Dr. Terra Sawinski, who will be our presenter for the webinar. Dr. Terra received her doctorate in naturopathic medicine and certificate in natural childbirth from the National College of Natural Medicine in Portland, Oregon. Dr. Terra uses a variety of natural methods custom prescribed to optimize each patient's health. These healing modalities include dietary and nutritional counseling, herbal medicines, homeopathic remedies, hormone replacement therapies, and physical medicine techniques. Dr. Terra has a special passion for the endocrine system and advanced training in natural hormone balancing for men and women. From hypothyroidism to infertility, diabetes to menopause, she is constantly searching for new ways to restore health. Dr. Terra is also a licensed midwife in Washington State and has traveled to Bali, Indonesia, and Vanuatu, helping to provide safer births for patients with limited access to care. Without further delay, I will now turn the webinar over to Dr. Terra.
All right, today we're going to be talking about the Meridian Valley food sensitivity testing that provides 190 different foods, and there's also options for environmental allergies. We're going to go through all of the components of the test, how to interpret. Here's a quick reference outline in case you need to skip to a slide. After we're done, you can go back and look at things. So let's get into it. The how and the what of the food sensitivity testing. We're going to go over techniques of testing and what is tested. So the first thing that we're looking at is how we're doing the testing. That's with an ELISA testing. Most people are familiar with ELISA testing, so I'm just going to go over it quickly. It's kind of a sandwich method with antibodies where you first got the food in the well, and then you add blood. The blood reacts with the food and attaches antibodies to it. You wash the blood out. The antibodies stay behind attached to the food. You add more antibodies. So an antibody to an antibody, those guys complex. So you've got food, antibody, antibody complex. You wash that out and right here, and then you add detecting antibodies. So third antibody that looks for that complex of the food, antibody, antibody complex. You wash that out. Whatever is left is then developed. That detecting antibody can be developed for a certain amount of time, and then you stop the developing. That gives us a gradient of color down here at the bottom, which will give us a gradient of reaction. So basically how many antibodies the body has produced to those foods over a standardized testing method. What's tested? We've got 190 different foods. They are separated by food categories, so dairy, meats, grains, things like that. There's also a Candida antibody on there, and the main thing we are testing is IgG4 antibodies. How are we testing? We're looking at blood work, so taking blood from a patient or doing a finger stick, also blood, but just a different technique. In the full blood test, we've got the ability to do foods and inhalants. This also combines IgE with the IgG4. And then in the food safe, which is the finger stick test, it's just the foods. Here's all of the conditions that you might want to do this testing for. This is not an inclusive list, but it's a lot of things that might clue your mind into wanting to do a food sensitivity test. All right, let's look at how to interpret these tests. Here's an example of a report. I chose 2 of the pages of 4 that you'll get if you do the combo, which is the 190 total foods. This just happens to be the first and the last page of the report. So when you're looking at this as a doctor, I look at it and I go, okay, let me draw my line here. It's going to go right down between moderate and low. I'm not a good line drawer. But if you draw those lines, anything to the right of the line, so in the moderate and avoid, is going to be things that patient's probably overreacting to, so creating a food sensitivity. And this is a good point to just talk about the difference between allergy and food sensitivity. We'll get into it a little bit more, but sensitivity would be something that's just not anaphylactic. Your body's still having the immune reaction that is similar to allergies. What about an extreme positive? So we're expecting something to come up if we're testing, but what if someone just is having everything come up as positive? In this particular case, you can kind of see here that the dairy is really high and an extreme positive. But remember, if I'm drawing my line, anything over that line could potentially also be an issue. And so it's not just the things in the high that are giving you an extreme positive. It's anything. So if you have a lot of things in the moderate area, so in this area as well, that would be considered extreme positive. If you've got someone looking like that, then they're going to get overwhelmed. So you want to recommend just removing things like dairy, gluten, eggs, corn, soy, and nuts. That's usually where I'll start, at least the nuts that they are allergic to, and then move on from there. You can also just remove high things, unless, of course, all of their things are in high, or that still feels like too much. Then start with these big allergen groups and work your way through the things that they're allergic to, remembering that you do want to avoid anything that they know they're having a reaction to. So, if it's not on this list, or it's maybe didn't even come up on the allergy or food sensitivity testing, you might want to just have them continue to avoid that. It's causing inflammation in some way. You also want to keep meals simple, so reminding people that it's really important to focus on protein and fat. When you take big food groups out, like dairy and eggs, you're removing a lot of protein and fat, so you need to make sure that you are getting those animal-based proteins in if they are not allergic to them, or finding other ways that are high protein sources and high fat sources so that nutrition can stay good. What about the extreme negative? So in this case, there's a couple of things to consider. Medications is one of them. Have they taken an allergy medication? You can see over here, everything is just in that low range. Nothing really even showed up in the moderate for this. This is an extreme low. This is someone who's extremely non-reactive, where their immune system is extremely non-reactive. So did they do something to create that? Benadryl or other allergy medications may cause this reaction to be muted. Also, immunosuppressive drugs can cause this. And so if someone's on an immunosuppressive drug for an autoimmune disease, you might consider that these food allergy tests are going to be less positive, not necessarily that they're not reacting, but they're less positive. You also want to make sure that they didn't decide to eat any of the foods that they thought they were allergic to, which could then bind a lot of the antibodies and cause a lower reaction. And also you can look for an immune suppression, a natural immune suppressed person, which would just have low IgE and IgG. That would also show up low. So if none of those are the case, then I guess we all just get to be jealous of people who have no food sensitivities. What about Candida positive? I do like to point this one out. So that's going to be on the last page at the bottom. You can see it here on this example, showing up as in the high range. This is an important one to point out and look at, because most of the time this does culture out in the stool as a candidal overgrowth. And so I've just taken to treating off of the testing when it's high, especially if the patient has not already treated for Candida and they have symptoms. So if we were suspecting it, you can use this as a screen, but also, you're getting benefit of looking at all of the other foods as well. Another caveat on this is if you suspect mold in a patient, a lot of times Candida will cross-react and mold will cause a high Candida as well. So if there's someone that's living in a moldy environment or you suspect mold illness, Candida could also be high in them. I will look for the other yeast-like things. So your baker's yeast, your brewer's yeast, and your mushrooms, all of those, if those are looking also high or there's more than one of them that's looking high, I am more suspect that there is a mold issue. You might ask about penicillin allergy and things like that. So how do you counsel the patient? That's how we're going to interpret these things and look at the things we're going to look for. But what about the patient? For them, I want to remind you to just keep it as positive as possible. I give patients homework. They need to be part of this process, not just talked at if they're going to be successful. And so give them homework to make a card of all of those things that they can eat. So anything in the blue, write them down, make your food categories, and carry that around with you. If you're out, you can look at what you can eat and look for those things on menus or at the grocery store. Also, you can recommend food substitutions based on what they're currently eating. If you take even just a one-day dietary intake during your visit, you can then tell them what substitutions can be put in that they can eat and which ones that they're currently eating that maybe need to come out. So give them a way to start to modify their diet that they're currently eating. That's not a huge change. That's also going to let them start to food plan or meal plan so they can just write down what they're currently eating. And over the next 2 weeks, find their little upgrades for their current diet and start to integrate those in. Over a month, they're going to be able to have several different meals that they have plans for, and all of those will be allergen free. If they're really getting overwhelmed, just take the biggest group that was positive. So on that one example of extreme positive, we had all of those dairy high. Take that out. Don't worry about the rest. Have them be really successful and start to build confidence in what they can do with their diets, and then move on to the next thing. I also like to discuss timelines with patients. Timelines are really important. I discuss a 3-week timeline, a 3-month timeline, and a 1-year timeline. So 3 weeks is a time where they may get hypersensitive. If they've been doing a good job avoiding foods, I make sure that we do a little coaching around not giving up at 3 weeks, or they may have a more extreme reaction. This is because the IgG4 really starts to come down at that point. Your body takes that breath and is like, okay, I don't need to look for these so much anymore. And then they start to become hyperreactive because IgE is still there. 3 months is one of those things where body can start to really clean out. So that is the first time that I'll generally follow up with a patient unless they need a lot of cheerleading. And so we'll follow up and make sure that they're doing well, check in on how they're feeling, and determine whether we're reintroducing or continuing on. And then 1 year is your general retest time. Make sure you schedule that troubleshooting, either the 1 or the 3 month, before they leave the office so that they know they already have a time where they're going to be able to ask questions and where they're going to be held accountable. So again, to review that follow-up testing recommendation, children and adults are a little bit different. Children do tend to heal quicker and they have not had issues as long. So usually their loads are not considered as high, or they clean out much more quickly. So 3 months is the earliest I would retest a child, and typically I still recommend 1 year because reintroducing at 3 months often just brings the sensitivity back for the patient eventually. Adults, I never recommend retesting before 1 year. They've had too long to develop these sensitivities, so they need more time to clean out, to heal, and to make new habits to be healthy. All right, so let's talk about a case where this food sensitivity testing really made an impact on someone's life. This little guy came into my practice with seizures and eczema. And just from this picture, I want to point out some things for you. We're going to look at his hands down here. That's some pretty good eczema going on his hands. We've got patches on his face. And then I want you to look at these lovely little shiners that he's got here. The thing you can't see in this picture is the eyes, which were kind of that, 1,000-mile stare instead of an interactive stare. And that I felt was also really important, but we cannot show you that. All right, so came in at 3 years old, seizures and eczema, full body eczema. As you saw, it was basically everywhere. It was also under his PJs. He had 3 seizures in the last 2 weeks. That is what really prompted doctor visits. Already been to the neurologist, recommended Keppra. The history of the seizures, total loss of consciousness for 10 minutes on the first seizure. That was a pretty scary one. It was after a fast food meal. He also had a seizure after Benadryl and after just a normal meal at home. And at this point, he was 3 weeks after that original seizure coming in to see me. He was still having about 5-minute bouts of this, like just kind of checking out a little bit and turning pale. So maybe not fully out of the seizures, but not full loss of consciousness seizure. Parents already had suspected a dairy allergy, so that was already out of the diet. He did have seasonal allergies in which his eczema got worse, and he had asthma, which required an inhaler during allergy season or pollen season. His diet's down here at the bottom. You can see a pretty good diet for a 3-year-old. I don't see any chicken nuggets or hot dogs in there. So he was doing pretty good. He was using an alternative milk because of the suspected dairy. And then they did not have any known environmental exposures or known mold, but were willing to look for it. So what did I see on his initial exam? He had plaques of eczema. So this was buildup, lots of scratching over most of his body. He actively scratched during the visit, was clearly uncomfortable. When I touched his hands and his skin, they were clammy and cold. He showed displeasure during the visit, but did not use words. And at 3, that's maybe a little, it is delayed. He had no enlarged lymph nodes, so no signs of like infection or anything like that. Just he was uncomfortable. Our initial plan, food sensitivity testing, I drew that in the office. That was also very uncomfortable because he had some eczema over those areas that we were drawing. And we continued the dairy-free. I added gluten-free because I was highly suspect that may also be contributing. And it looked like a few modifications of his diet would be able to be successful with that. We also counseled on organic foods to keep the pesticides out and reduce overall toxin load. Added a few things, B complex, C, quercetin, and chlorophyll topically to help with the eczema and allergies. And because of the brain, we added RG3 nicotinamide riboside spray, also known as synapsin, to just help reduce that inflammation and reconnect some of those neurons that might have had some pruning. Plan was to follow up in 3 to 5 weeks to go over treatments and look at the food sensitivity testing. So here's his follow-up picture around his follow-up time. And this, he's still looking pretty eczema-y here because we just avoided a few more things and did a few treatments. So they helped a little bit, but you can still see eczema all over his arms and his face. We still have the allergic shiners that are pretty prominent as well. So mom reported that they did a pretty good job on gluten-free and organic. They were really close to 100% on that. He has had no seizures since last in, and they did find mold in the house and already had a plan to deal with that. Eczema was the same, and food sensitivity test revealed multiple foods for concern, which we will go over in a minute here. Our follow-up plan for him was to continue the previous treatments that we had talked about. They were possibly helping a little bit, especially with the seizures and maybe some energy and things like that. And then avoid all of the high or avoid foods that came back on the food allergen sensitivity test because it is significant and it would have been overwhelming and too limiting to go for the moderate foods, but we were going to work down towards that. So this is his actual test. And you can see that this is a great example of extremely high results. So if I'm drawing my lines down these lines here, you have a lot of things over the line. You have a lot of yellow and red, a lot of yellow and red. And they were right on dairy. This is his dairy section right here. So again, we really went for anything in the avoid category only to start with, had him remove those things and focus on eating as many of the blues as possible, but not worrying too much if some of the yellow foods got in there. And of course, continuing to avoid the dairy, the gluten, and working on organic foods. So then we did a second follow-up about 2 months after his initial visit. So this would be about a month after test results. And this is a picture from around that time. A few things to point out is the smile and the skin that is fairly clear. We're also looking at these little shiners are improving. We don't have so much pink or swelling, especially not over the top of the eyes. So we've got some improvement there. He has had no seizures since last in. They've been doing a good job at avoiding most of the allergen/sensitivity foods. They did remediate the mold in the house and got that taken care of. And he started to make some developmental milestones come back. So started speaking in sentences again, more coordinated, more playing with his brothers and interacting with other people again, sleeping better, which was not initially noted that he wasn't particularly sleeping well, but he's no longer waking up to itch just once per night, which is pretty common at this age. He's a generally happier kid. And the only thing that was left eczema-wise was a few patches around his ankles and wrists. So our follow-up plan on this, we're going to continue to avoid the sensitivities foods, and we tried some diamine oxidase just to try to mop up the rest of that histamine that we were looking for. I did have him switch to chlorophyll internally to try to clean up the digestive tract, and I added a binder for a short amount of time to help clean up some of the biotoxins from the mold now that he was out of the exposure. All right, so his third follow-up. This is a year out from first visit and 11 months from test results. During the allergy season, we did add a marshmallow glycerite to deal with some of the asthma symptoms, and he did not need his inhaler that season and was doing much better as far as breathing. He was doing a lot of growing and developing and no seizures this whole year. He has been playing outside. He has been helping in the garden. It's a little itchy with that, which isn't a surprise. He is learning more and more, taking off, sleeping well. He's still avoiding his allergen foods, no eczema on this exam. His plan for this visit is to just continue to avoid the allergen foods. I had already started to challenge a few. We gave some instructions on appropriate challenging of foods to see if they might cause problems, and they were able to manage those. He kept natural antihistamines around and marshmallow around for pollen season or any exposures of known allergens, and we went to yearly well child checks for him. And there he is over that year, getting happier and happier and playing outside. You'll notice some changes there in a kid that first just kind of looked like he was trying to be alive to a kid that actually is living. So this was a pretty cool thing to see how much progress could be made in just a year. All right, let's talk about something that's related to IgG4 allergy testing, sensitivity testing. That's IgG4 related disease. You can see the list here of all of the things that may be related to IgG4 related disease. This is more of an emerging thing, came out in the kind of early 2000s, 2010s, started gaining some pretty good hold. So we're still new in figuring out what this is and how it may affect us long term. But basically, you have a lot of IgG4, so what we're testing with the Meridian Valley test, and that eventually infiltrates tissues and causes tissue dysfunction, inflammation, and fibrosis. Here's some symptoms you might notice with IgG4 related disease. Now, these are pretty common symptoms of patients that come in, right? I mean, autoimmune diseases. That's a really general category, but we've got infiltration of immune globulins that are going into the organs, and so that's basically autoimmune. So looking at these kind of common symptoms, looking for those in your patients, especially the patients later in life. This does tend to affect males more than females as well, so that male that you might just get to come in once, make sure you have their IgG4 allergy sensitivity panel to see if this could be related to any of their symptoms. So what is happening in IgG4 related disease? The immune reaction starts with the IgE. That's your true allergy, right? That's what's going to give you anaphylaxis. So you'll get IgE buildup from the exposure to whatever you're having a problem with. And because you don't want to die from the anaphylaxis, your body creates IgG4. IgG4 is our adaptation for survival. It goes in, it blocks IgE. So it says, hey, don't die. Just have some of these food sensitivities that we've been talking about that cause chronic illness, but don't kill you, at least not right away. So it'll go in, it'll block, it'll make sure that you do not die from that food that you had an IgE reaction to. Some people don't build up IgG4 to certain things. Common food things like peanut allergies causing anaphylaxis is an example there. They just are not able to adapt to that. So what's happening really when you get all of that IgG4? It then goes into the tissue. Do we need somewhere to put it? I'm not sure. Is it part of just an autoimmune infiltration? That's also a possibility. But it infiltrates and causes sclerosing. This is a picture of a kidney that's sclerotic. That's a very common organ that is known for infiltration of IgG4. We also look at the aorta, so heart disease or sclerotic arteries, the eye, so any vision issues, and the one I really worry about is placentas. Placentas get sclerosed, and that could cause a lot of issues with early loss or even late pregnancy loss if they get significantly infiltrated by a mom that's got a lot of this IgG4 buildup. Another thought would be that there might be some cross-reactivity. So if we've got an allergen, there could be two kinds of cross-reactivity. Two different allergens that look similar are going to cause antibodies that could both potentially react whenever you get either food to both spots. So, if you eat, let's just say carrots, and it looks like some other food, you will get that reaction. It will go in and it'll react to both foods when you eat them. So in this example, we've kind of got the heart and the triangle. The triangle fits in both the triangle spot and the heart spot, and same with the heart because they both have those lovely little pointers. Also, you could have a spot that looks like a triangle in, let's say, one of your organs that could cause infiltration of the hearts and the triangles. That would cause a lot more infiltration, which would up the ante on IgG4 related disease, causing sclerosis faster. And that is one of those mechanisms that they're thinking about for autoimmunity. So an example of that would be beef does cross-react and into the pancreas and the kidneys. And so kidneys is one of those IgG4 related diseases. Looking for beef on that food sensitivity panel may give you a clue in a patient that's maybe in their 30s, 40s, or 50s that IgG4 related disease could be contributing to some of their symptoms like kidney problems or arterial issues, maybe high blood pressure, things like that. So just a thought to keep in the back of your mind about what could be happening, and testing this early can prevent IgG4 related disease from happening because you will not have high loads later in life. All right, that's everything. I hope you learned something that can help your patients today and got some tidbits on how to use the food sensitivity testing.
For any questions or issues you may have, please contact Avexia Diagnostics by email at info@avexiadiagnostics.com or by phone 5 days a week at extended hours, 8 a.m. to 8 p.m. Eastern Time at 888-852-2723. Thank you, Dr. Terra, for this informative presentation. Thank you again for joining us for this webinar event. Until next time, from everyone at Avexia Diagnostics and Meridian Valley Labs, stay healthy, stay safe, and we wish you all the best on your pathway to wellness.